When was your last Pap test? Was it normal? If you don't know the answer to these questions, it's time to see your gynecologist. Welcome back to my channel. If you're new here, my name is duPont. I'm a board-certified gynecologic oncologist, and I'm passionate about educating women on how to lead long, healthy, productive lives. Well, today we're going to talk about Pap test screening. I have put some videos out already about Pap tests, but I was on call over the New Year's Eve weekend, and I had 3 consults, and none of them had had a Pap smear in over 10 years, and they all had abnormal bleeding. So I thought, I'm going to make a refresher video just to remind you on the importance of the Pap test and to remind you to see your GYN doctor. If that sounds good to you, please continue watching. Okay, so what is the Pap test? The Pap test is a screening test for cervical cancer. Cervical cancer rates are rare, or I won't say rare, but they're lower in the United States because we do so many Pap screening. But we're finding patients, especially women that are done with their childbearing years, just aren't going back to their GYNs to get a Pap test. Now, you don't need Pap smears every year because the testing's gotten so much better. Typically, we'll do Paps every 3 to 5 years, depending on your age group, depends on your risk factors, and depends on your prior Paps and if you're someone that had frequent Paps in the past. We used to think that when you went to see your GYN doctor for your annual exam, you needed a Pap test. Well, remember again, that's not the case anymore. When do we start Pap screening? We usually start at age 21. It's very rare to get cancer of the cervix under 21. I have seen it from time to time, but it's extremely rare. And so if you have someone in your family, a daughter or sister that's 21 and hasn't had a Pap test screening, please encourage them to see their GYN doctor. And then next, a Pap test does not screen for ovarian cancer. So, I have patients from time to time that maybe there are new diagnosis of ovarian cancer. And like, well, I had my Pap test at my well woman. Why didn't it pick it up? The Pap test really only picks abnormal cells in the cervix. Now, I will say from time to time, I have had patients where they've had some abnormal cells from the fallopian tube or the uterus actually be picked up on the Pap, but that's not the primary purpose for the Pap test. When we do the Pap test, what we're looking for is the base of the cervix here, and we're getting some cells that kind of slough off. We normally do that, a Pap test, in addition to an HPV test, which is a test for human papillomavirus, usually after the age of 30, because we know from the ages of 21 to 30, a lot of young women have been exposed to human papillomavirus already. So typically we screen after age 30. Now, your primary care doctor may do primary HPV screening at 25, and that's also indicated. But typically we don't screen the youngest women for human papillomavirus. But if you have a Pap test and your doctor said your HPV was abnormal or your Pap was abnormal or both, just make sure you follow up, because a lot of times I'll have patients that they get busy and they forget to follow up, or they knew it was abnormal, but they just don't want to deal with it right now. If you had an abnormal Pap or an HPV, please see your primary care doctor because it is important. Well, thank you for watching to the very end. That's all I have today on Pap test screening. Remember, if you haven't had a Pap in a while, or if you can't remember if it was normal, abnormal, please see your women's healthcare provider to get a Pap. It's really easy, and it's a good way to just make sure that you're up to date on your cervical cancer screening and that you don't have anything else that the doctor can pick up really easily. Alrighty, so we're starting a new year, so make sure you put your health, you make your health a priority. Thank you for watching, and I'll see you in the next one. Bye-bye.